Okay. Okay, so welcome everyone. And I mentioned that our friend Zishan Hamid has volunteered to handle the technical side of this. So he'll be putting up our presentations. We're just talking about the fact that this is being recorded and will be made available. So if there are people that you know that weren't able to make it tonight, it'll be available for them to see. Our presenters are going to be available for questions at the end of their presentation, and you will be asking questions through the chat, and I will be repeating them. And if I miss them, Zishan will repeat them. If there are questions that you have that aren't answered, then the presenters have put contact information up. And also, if you wanted to email us at nassruralwatch@gmail.com. So I'll put that in the chat box, but that's the same thing for people that have been registering. So nassruralwatch@gmail.com. And if I lose my connection, that's one of the joys of living rurally. Our Mike from our committee Mike McLaughlin has volunteered to take over. So in terms of the agenda, our presenters are Sergeant Richard Dodds from the Milton Detachment, and followed by Alexandra Fisher from the Fire and Life. She's a fire and life safety educator with the Milton Fire Department. That will be followed by Greg Sage, who's the Chief Director of Halton Regional Paramedics. Then Cindy Luna, who's a member of the board of DCCA, which is Destination Campbellville, and they're co-sponsors of tonight and of the roadside cleanup, will speak. That will be followed by Betty Robertson, who's on our NCCC committee and also is the chair of roadside cleanup for the fourth year. It's been a lot. Cindy's going to follow again as an Action board member and give you an update there on ACTIONMilton. Colin Best, who's our town and regional councillor for Ward 1, is going to join us, and he has a presentation. And then last but not least, Christina Tesser Derkson is going to join us. Okay, so Sergeant, do you want to lead us off?
I will. Hello, everybody. Thank you for having me tonight. It's my second time here. I know that I have assigned an officer to be a member of this unit, but he's always busy while you're having meetings. So the Sarge gets it. So once again, thank you. I put together a small PowerPoint here. As you can see in the front picture, this is my team. I have a very small team. I have 8 officers that are part of my team. I just brought in one. We lost one to the OPP, and I just brought a new officer in. His name is Dean Anu. If we could go to the next slide, please. So what I have to do every year is create a business plan for one district. And that includes Nassagaweya, Milton, Georgetown, Acton, and then the small hamlets, Norval, Glen Williams. And what I want to show you here is when I first came to this team, essentially what happened was with 8 officers, they divided 2 officers per platoon. We carry 4 platoons on the road. So those 2 officers were absorbed into the uniform patrol teams, and they had a hard time focusing on their duties as district response officers. So when I came in, I restructured the team into 2 teams. They work 12-hour days, 48 hours a week, and they overlap each other. So there is no day off where I don't have a Drew team on the road. I won't be a talking head here, but part of our mandate is to respond and support uniform. So my team is also trained in high-risk, low-frequency calls. As Chief Sage understands, my background is tactical response. My officers are able to respond anywhere in the region, Burlington, Oakville, and they are trained in containment and support for the tactical rescue unit. Next slide, please. So I'd like to talk about our complaint system. First, let me say, I deal with 4,000 complaints a year. I'm sure you can understand that is a high volume of complaints. And this is what we go through with every complaint. So we get our complaints through you, the town or the region. And then what we do using our teams, I'm in close contact with Heidi in Milton, with Maureen in Georgetown, and we scan and we analyze. Now there's a number of systems that we use. I have an analytics team on our service that I can use. And as well, the region has been very good, especially when you're talking Guelph Line. Heidi's great on Campbellville Road, where you'll see those speed signs up. They actually collect data for us. We can respond and analyze. And I also send officers out there so that they can verify whether it's a perceived issue or whether it is a real issue. From there, we break it down into three. Is it a high risk? Is it a medium risk? Or is it low risk? And then we select our response from that. Once we have done that, and what we do is through our analytics, when we work, like right now on Campbellville Road, we have a hashtag that we use that when our officers clear a traffic stop or clear a call, they hashtag, and then we can then analyze from those hashtags how effective we are with and assess what we're doing. Next slide, please. So I'm not going to be a talking head here, but there's a few points that I want to address. In the red bottom box, incident response, enforcement in areas of impaired driving, collisions, and traffic safety. We are also supported by MAD Canada. And with that, we have to do certain things like ride checks, sobriety checks. The provincial government has brought in mass testing for us. So that's all part of the incident response. Underneath in social development, you'll see the second line, decreasing chronic complaints. What I'd like to point out here is it doesn't matter if one person sends me 5 complaints a week or 1 complaint. They get the same attention. So what I'm saying is, I'm not saying that I miss complaints, but rarely does it happen because we make a report on every complaint that comes in. What we try to do with decreasing chronic complaints is we'll go out there, we'll engage you, the public. We want you to see us out there working, and hopefully that will make you feel better in knowing that we are working or have identified the problem. On the bottom of social development, commercial motor vehicle enforcement and initiatives. We've worked very hard. I now have 2 officers. One is fully qualified to be a commercial motor vehicle inspector, and another officer is just halfway through his training. It's a 22-week training cycle, so you can understand I lose that officer for those 22 weeks while they get trained to become a commercial motor vehicle inspector. But once I have them, I will have 2 fully trained inspectors. And I know, especially in Nassagaweya, we have a number of issues with commercial motor vehicles using marked roads where commercial motor vehicles are not supposed to. And as well, they're trying to get off the highways to evade the MTO. They'll run into us. Over on risk mitigation, the yellow box, you'll see identifying critical high-risk locations. We really rely on our work in an area as well as the region and the towns. And I'll use an example. It was traditionally thought that the best time to do ride spot checks was when the bars were closing down. Through analytics and assessments, we have now learned that the hot spot to do ride checks is after happy hour. So most people finish work, will go have a few cold ones, and then drive impaired. So that's had to change our way of thinking and how we enforce this. So now we are going out, we are doing mass, we are doing roadside tests during that happy hour. So basically from 5 p.m. until around 8 p.m., you'll see us out there doing it. And we've had to change the way we think and do things because the analytics have told us that is the way to go. And then underneath in the blue box, prevention, social and our media and social media messaging. One of the things that when I came into this team is that we were not putting out the great work that my officers are doing. They're hardworking. I think you'll see later on what kind of things they do, but we need to let you know what we're doing, where we're doing it. And so what we've done is I've got all my officers now trained in Twitter, and they run off of the Milton Twitter page. And quite often you'll see like some funny posts by my people. Laura Brooker, for instance, last week put out, "Did you hear that?" And she got a car with no muffler, bald tires, no brakes. And so what we're trying to do is effectively use social media, and you'll see this coming up in a slide, that will engage you, the public, let you know what we're doing. And we're hoping what it will do is make it seem like there's 100 of us out there. Next slide, please. So this is our impact from 2022. I've been the sergeant in this unit since 2021. I've had a number of initiatives and projects that I've pushed in the changes to our unit. And as you can see, the changes have resulted in quite a rise. So we've responded to over 2,200 calls for service. Now that is my unit supporting uniform as well as doing their main mandate, which is traffic. My unit's been involved in 71 impaired arrests and investigation. I have 6 out of my 8 that are qualified breathalyzer technicians. They not only do the arrests and the breathalyzers, but they also help uniform in working their way through an impaired arrest. You may not know, it takes about 6 hours and a mountain of paperwork for an officer to just make one impaired driving charge. Our stunt driving has gone up 40% in 2022, and we had 138% increase in 2021. Just my unit, just those 8 officers that have given out 2,600 provincial offense notices. They've made 3,260 traffic stops. We work on Noisemaker, which I'm sure you're aware of that project, and we've given out 66 improper or no muffler offenses. As well, with my 1 commercial motor vehicle inspector, we gave 425 commercial motor vehicle offenses last year. I'm hoping to go 4 times that this year. Next slide, please. This is what I was talking about, social media. So last year we had over 1 million engagements with our content. We ask that we ask that your family, we ask that your friends join up, follow the HRPS Milton Halton Hills Twitter page, and engage with their tweets. So what I put up here was just one from Laura Brooker last week that was on Guelph Line in Brookville, where she stopped the car doing 105 and a 60, which is a stunt driving offense. And we post, like I say, the great work that she does there. Next page, please. Our initiatives for this year. So we've just finished February. I don't know if you're aware, but the government just changed all the towing laws in the fall. So we wanted to get out there in February and see if these new laws were effective. In a way, they were. We worry a lot about the public essentially getting defrauded by tow operators. That's what all these changes in the laws were about. And so we went out there for a couple of weeks and essentially made sure that the tow operators were following the rules. You can see that reduced racers in the rural enforcement has just ended. That was an initiative created by Burlington up into Nassagaweya, where we worked together with 3 districts. And I have some results from that. Especially, we identified some areas in Nassagaweya and we kept on them right up until this month. And I think the rest you know about, or you will hear about. and they will always be advertised on our Twitter page. The big thing is Motorcycle Awareness Month, and starting in May. I am a police motorcycle operator. I have my own motorcycle. I made a number of videos last year for it, and I hope they don't ask me to do it again this year. Next page, please. So here's the meeting that you want to hear about. So the Bear in the Woods, we identified Campbellville Road essentially as the main catalyst. Guelph Line, south of Campbellville Road, was another. We have found that the new traffic measures on Guelph Line north of the racetrack, I think you know all the construction is done up there now. They've got the lights in place. We have gone and we've studied around the school. Everybody is actually really good around Brockville School. And we're finding that the speeds go no more than 15 kilometers an hour over the speed limit north of that. So what we did is, this is essentially, and I'll be honest, Campbellville Road. We've been out there for the past month. We've been out there 10 times with a full team each time we go. And we've issued, just from 1 March till 1 April, 61 provincial offense notices. Now a part 3 is a summons, and that's for stunt driving. That's for major offenses where there is no set offense. We actually issue a part 3 and give them a court date and summons them to attend court. We gave out 14 warnings and 19 motor vehicle tickets. And if you have any questions on that, you can ask me. We are going to be following up out there. Don't think that now I go, okay, April 1st is here. We're done. We don't need to worry about it. But if you have any questions on that, we can talk about it. And then my last slide, please. So you want to know about the occurrences in Nassagaweya this year. And this is these are the criminal occurrences that were being investigated or are still being investigated. We've had 2 theft over $5,000 offenses out in your area. One, there's been a break-in of some mailboxes where the government actually had to hold back some checks so that they couldn't be stolen out of them. And then there was an offense of some cigarettes being stolen from one of your realtors downtown. There was a break and enter where what was taken was a water conditioner. We've had 2 stolen autos, one from Mohawk Racetrack and one from a private residence on 6th Line. We've had an assault from a road rage incident, a cyclist and a male in a pickup truck that is still being investigated. And we've also, March 1st to April 1st, have been out there quite a bit doing ride and doing random checks. We've had 2 impaired arrests in that month out there, and we have done 26, we call them 946s. They are 3-day suspensions just from your area out there. And that's my last slide. So if there's any questions.
That's great. Thank you very much. Do we have any questions at this point? Jim, do you want to use the chat, or do you want to, are you just asking a question? I can actually see you. So were you asking? Go ahead. Yeah, you have to unmute yourself, Jim. You're muted. Yeah.
Okay. I noticed today on Campbellville Road at the intersection of Guelph Line, there was obviously problems on the 401. I think this is going to continue in the next when they're doing work on the 401. Is there any police response to try and control traffic that's backing up on the Campbellville Road there? Huge trucks coming through. They probably get 4 or 5 through on the lights at a time. And I'm just wondering if there's any police response to that kind of a situation in the area.
Jim, we don't have one, and it's a good question. And I understand once they call it the triangle, once there's a backup in the triangle, that we're getting trucks coming off the road, and that's where they're starting to use the no truck routes. But no, there is no alternative. there's not one made for us to redirect traffic, if you understand what I mean. So if let's use, for instance, Highway 25, if we have a backup on the 401 and 25, we have alternate routes where we can redirect traffic north and south, and they can go along Derry Road, or they can go up to Five Side Road and down through Campbellville back onto the 401. But once they get stuck out by Campbellville, what's their alternatives? All we really have is Campbellville Road, right?
I'm just wondering if there was any police traffic control or anything like that to allow more traffic to get off of Campbellville Road onto the Guelph line to get back onto the 401. At times when there's no traffic really building up on Guelph line, and the lights are set at what the lights are set at. So
that's a good point. Okay, so what I think I will do is I'm going to take note of that, Jim. I will speak with Heidi. We'll make up an alternate route plan, and should there be an issue, hopefully we can have an officer come out and direct traffic. So let me work on that, but that's a very good idea. Good idea.
Great. Great. Nicole, I think you were waving your hand.
No, I was just applauding, but thank you.
All right, that's great. Okay, well then, you can obviously send questions to Sergeant Rick, or as I said, send them to us and email them to us, and we'll pass them on. So at that point, or this point rather, I'm going to introduce Alexandra Fisher, and as I said, she's the fire and life safety educator from the Milton Fire Department.
Hi, everyone. Thank you again for having me today. So this is the first time that Milton Fire and Rescue Services, previously known as Milton Fire Department, has ever had a fire and life safety educator. So I was hired in July, and so I've been out here in Milton trying to reach the community when it comes to fire and life safety education. So within the fire service, we have 3 lines of defense. We have public education, which is my role. It's the most important role because we want to prevent fires from occurring and fatalities. And then we have enforcement, which I do as well. So that's inspections, making sure everything's up to fire code and safe for individuals and their businesses and their homes, things like that. And then we have fire suppression, which is the firefighters. So I understand that the chief spoke to this group about response time. And so I'm going to focus more on fire and life safety and prevention, because unfortunately, the closest full-time fire station we have to Nassagaweya is on Steeles Avenue. So that's our station 4. So Steeles in the 401, around that area. And we're looking at a response time on a good day of 20 minutes to 30 minutes. So I'm really going to focus on what you can do at home to help you prevent fires, but also to be prepared in case something ever did happen. So with fire and life safety, there's always the 3 fire and life safety principles. And I'm going to discuss those. And I'm going to talk about some electrical hazards and fire hazards that could potentially be an issue within the home to get you all up to, par and make sure that you have everything that you need to know to keep yourself and your family safe and to be prepared. All right, we can go to the first slide. So smoke and carbon monoxide alarms. So of course, the purpose of smoke alarms are to detect if there's heat, fire, or smoke within the home. So you have about roughly 2 minutes to get out of your home safely if there was once the smoke alarm sounds. So it's important and it's law to have smoke alarms on every level of the home and outside sleeping areas. Or if your home was built after 2013, you should have a smoke alarm in your room, like the sleeping areas as well, just for added protection. But they need to be on every level and outside sleeping areas because that is the law here in Ontario. So we always recommend testing your smoke alarms once per month. So you can just do that by holding down the test button. The thing that you see on the screen here is what's called a strobe alarm. So that is the most common alarm that's used right now. And we're seeing a lot of these go into the newer homes. So this acts as a smoke alarm and a carbon monoxide alarm. So when it comes to carbon monoxide, the law here in Ontario is carbon monoxide alarms need to be outside of sleeping areas if you have any fuel burning appliances or an attached garage. So we also recommend them being on every level of the home and close to those fuel burning appliances. So if you have a gas stove at home, if you have a gas furnace, if you have a gas clothes dryer, a fireplace with a chimney, these are all things that you need to have a carbon monoxide alarm for. Because the thing with carbon monoxide, I'm not sure if everyone realizes, they call it the silent killer because you can't smell it, you can't see it, you can't taste it or touch it. So we always make sure that we tell everyone you need to have an alarm if you have an attached garage or any fuel burning appliances. Just because, you know, a lot of deaths happen in the night without carbon monoxide alarms. You need to make sure that you can keep yourself and your family safe. If your carbon monoxide alarm ever does go off, we want you to just get out of the house, call us. We're going to come in and we have a detector to be able to determine how many levels of carbon monoxide are within the environment. And we'll just open your doors, windows, make sure that it's all clear before we let you back in. But like I said, you need to have them. It's the law and they will save your life. So it's important that you have both those things. And so testing, of course, we want you to test them once per month, both carbon monoxide and smoke alarms, to make sure that they're in working order. Because if they're just on the ceiling for 20 years and you don't know if they're working and you're not maintaining them, they're not going to be able to save your life, okay? So smoke alarms and carbon monoxide alarms all have an expiry date of every 10 years. So once you get a new unit, you need to make sure that you put the date on them and that you're testing and you're making sure that, you know, it's not coming up to the date. And if it does come up to the 10-year date, you should be replacing them immediately. Typically, you'll have sometimes you'll have just a battery operated one or an interconnected wired alarm. So you have to maintain what your house already has. So if you have a wired interconnected alarm, you need to maintain that. You can't just go out and replace it with one that's battery operated. So maintain what you already have and make sure you're testing it and make sure that you're switching out the batteries every 6 months, so twice per year, and then replacing the entire unit every 10 years. So it shouldn't be up on your ceiling longer than 10 years. You should know the date that you installed it and you need to maintain it, because a lot of people, what they'll do is they'll have one, but they're not maintaining it. They don't know if it's working. And then at that point, it's not going to save your life. And for you guys being so far away from our Steels location or Steels station, you need to make sure that you have all your fire and life safety stuff put into place and that everything's working. Next slide, please. So home escape planning. So this is another huge fire and life safety principle. So this is for all ages. So every age group that I go and speak to, I say you need to have a home escape plan, whether you're in a condo or a home. You need to draw, basically it's a floor plan. I don't know if anyone can, basically it's a floor plan of your entire home, okay? And you're gonna go through your home and you're gonna have 2 ways out of each room. So not just the bedroom, you need to know 2 ways out of every single room within the house. I want you to go around the house, make sure that you can open every single exit. So your windows, your doors, that they all easily, you're able to get out of them easily. Nothing's blocking an exit or a means of egress. So you have to have everything clear. No combustibles piled up against an exit or things like that. So have 2 ways out of every room. And a safe meeting spot. So that'll be in the front of the home, a safe distance away from the home because, you know, fire will spread. So safe distance away, and it always needs to be in the front of the house because when we come with the fire truck, we're going to go to the front of the house. So I always say, I want you to go through this with every single person you live with and determine every single exit out of the house and come up with a safe meeting spot together. And if anyone has any mobility issues, so if you have any babies at home or if you have elderly grandparents or whoever it may be that has any kind of mobility issue that can't get out safely by themselves, you need to really determine who's going to be in charge of getting that baby or that other individual out safely. Because, you know, if everyone's just panicked, if there's a fire at home, people panic and everyone's going different directions. No one knows if someone got the baby out. You just always want to make sure you're prepared in case of an emergency situation. If you're unable to escape, this is a question I get asked all the time. And I always follow it up with, this is the worst case scenario, because when you have working smoke alarms, they're meant to save your life and they will save your life if they're working. So I always say, worst comes to worst, you have to do a shelter in place. That looks like staying in a room You're gonna block off the exit. So if your door's shut, I want you to put whatever you can find at the bottom of the door to stop the smoke from entering the room. And you're gonna go to the window. And if it's nighttime, use a flashlight, or you can shine a device, whatever it may be, to kind of alert people to your location. And you're gonna wait there. That's called a shelter in place. But again, worst case scenario. So you wanna block off the exit from the smoke from entering and just wait in that area. So when we come on scene, we do a walk around, right? So we'll hopefully be able to see that individual who's in the window or wherever they may be trapped, and we'll do a rescue that way with the aerial ladder. But again, this is the worst case scenario. We always want to make sure that we're sleeping with our doors shut. In an event there's a fire in the home, that's going to block the fire from spreading so rapidly to that bedroom. If you're leaving the house, if the smoke alarm sounds, you find fire in your home, you want to just try to make sure, if you have enough time, to shut the door on your way out, because shutting that door is going to block that oxygen from fueling the fire within your home and spreading that fire more rapidly. So just kind of remembering that, because every door, is fire rated. And then so getting out and staying out. If you have pets or anything like that, if your smoke alarm sounds and you're able to grab your pet and get out safely, please do so. But you're never going to go back in for a pet or anything, or a belonging or anything like that, because like I said, you have less than 2 minutes to get out safely. So we want to ensure that we're out safely and we're not going back in for anything. If there's a pet trapped, we can do a rescue when we arrive, if that's the case, but we don't want anyone going back into a burning building, because they might not make it out safely at that point. Okay, we can move on. Okay, so electrical safety. So we have to be aware of electrical safety when we're at home. So never overloading outlets. So if you have any power bars, we want to keep the cords to a minimum of 3. Unplugging appliances when you're done with them is always a good idea. So even the coffee machine, when you're done using something in the morning or whatever it may be, just get in the habit of unplugging everything when you're done. So power bars, you can flip the switch, turn it off. There should be no electricity running into appliances that you're not utilizing at that time, because it could be a potential fire hazard. We always want to make sure that we're checking like our chargers, our extension cords, power bars, things like that. We want to make sure that we see the symbol CSA. So that's just going to tell us that it's Canadian Standard Association tested. So it's fire rated, it's safe, it's tested, things like that. If you're buying things from the dollar store, those aren't tested and they're from China and they're just not safe when it comes to electrical safety. They are a huge fire hazard. So we just want to make sure that we're doing that. Heating equipment. So if you're using any like heating equipment, keeping it 3 feet away from anything that can burn, anything combustible. Chimneys, if you do have a fireplace, please be getting it inspected annually and cleaned out annually, because what happens is they back up and then that could cause a fire, or it could push that carbon monoxide back into our environment, right? If we're not getting things properly checked and annual inspections done on them. So any frayed or damaged cords to our electrical appliances, huge fire hazards. So just look around, like if you're, just go through all your appliances, your power bars, your cords, things like that. Make sure there's no frayed or chips or cracks on them. And if they are, then you need to get rid of them and just purchase new ones. All right. Next slide, please. So safe cooking practices. So I always cover this because unfortunately, cooking is still the leading cause of at-home fires and injuries. Smoking is the #1 cause of fatal fires at homes, but cooking is pretty much up there as well. So we want to make sure that if we're frying, grilling, or boiling on the stove top, that we are attended to our cooking at all times. If you need to step away for a second, have someone step in or just turn off the stovetop completely. We don't want to have anything boiling on the top of the stove and leaving that unattended, because that's when the fires do occur. If you have something in the oven, make sure to set timers to alert you, your stuff's done. You can stay within the area, but it's mostly when you're frying, grilling, or boiling. We want to make sure that we're in the kitchen. We always have to be alert. So never cook when you're under the influence of alcohol or medication, things like that. We never want to do that, because then we can, maybe not be as alert as we should be. Panhandles turn inward when you're cooking, so they can't become knocked down for like burning yourself, things like that. If a fire does occur on the stovetop, what you're gonna do is basically, if you have a pot, it's on fire, you're going to slide the lid. You always should have a lid when you're cooking. And so you're gonna slide the lid from the side to kind of cover the fire and contain it, and then turn off the stove and get out. I always tell people to get out because we don't know if that fire's actually out. And the thing is, like, fire likes to hide. So sometimes we go to fires and we think that we've got it all, we put it all out. And then an hour later, it's fully involved, like a house is fully involved because it likes to hide. So I wanna make sure that you guys get out. And never put water on a grease fire. So a lot of people cook with oils and grease and things like that. So we never want to put water on that. It doesn't mix, and it'll cause the fire to spread and to basically expand. So we want to make sure that we're utilizing fire extinguishers, is what I'll talk about in the next slide. Okay, so I always recommend having a fire extinguisher at home, and I don't want you to put it in the kitchen. I want you to put it close to the kitchen, because if there's ever a kitchen fire, you need to be able to easily access that fire extinguisher. So close to the kitchen, maybe in a storage cabinet or something, or if you want to mount it, that's great too. But I would say to get an ABC fire extinguisher. So that's a combination extinguisher, and you can get that at any hardware store. That's going to cover you with your ordinary combustibles. So your paper, plastic, wood, fabric, things like that. It's also going to cover electrical, like energized electrical equipment, like I spoke about as well as flammable liquids. So it will cover you on the grease. And we only want to put out a fire with a fire extinguisher that's smaller than, say, like an office trash can, nothing bigger than that. I just want you to get out, call 911. But if you do have a fire extinguisher to utilize, it needs to only be a fire that's, you know, a small size. And so there's videos on YouTube that you can check out on how to like properly utilize this fire extinguisher, but we call it the pass method. So basically there's a pin on every fire extinguisher. You're going to pull that out. You're going to aim it at the base of the fire. So the center of the fire, you're going to squeeze the handle that's on the fire extinguisher, and then you're going to sweep with your arms to put that fire out. And so what will be in that fire extinguisher is a chemical agent, and it's going to smother that fire. It's not water-based because, of course, like I said, we can't put water on a grease fire. We can't put it on electrical equipment. We can put it on ordinary combustibles, but this one is a really great combination fire extinguisher to utilize at home. So that's the one I always recommend. And you can get like a 5-pound. I would say that would be good enough. And for maintenance and storage, like I said, so you want to keep it close to the kitchen, not in the kitchen. But we always want to make sure that here and there we're checking it to ensure that it's in the green. So on the top of the handle there, you'll see this kind of like circular area. And so within that, it's going to show green or red. So you always want to make sure that it's in the green, and it's going to determine if it's full or whatever. So it needs to be full in the green. And if it's not, and it needs to be replaced, we just say properly dispose it at the dump and just buy a new one, because it's going to cost a little bit more money to get it refilled. So you're better off to just buy a completely new fire extinguisher. You could also keep them in the garage as well, wherever you think, like the more the merrier, but always keep it close to the kitchen. And here and there, you can also give it a shake to kind of make that powder within it. The extinguisher needs to kind of be dispersed. Otherwise, if you go to utilize it, it might be at the bottom of the fire extinguisher, and it might not disperse evenly if you had to utilize it within a fire. And yeah, next slide, please. Okay, so as I was mentioning when I first came on Zoom, I was talking about how we're implementing a safe home program with Milton Fire and Rescue Services. So this is across Milton, and it's a smoke alarm safety program. So we're launching it this summer, and we're having each individual fire station. So every crew is going to go through Milton. They have a certain designated area. So I believe Station 1 on Steeles Avenue would have Nassagaweya. So they would go to each individual house, and we're basically door knocking, and we're just going to kind of offer free fire safety inspections. So we're going to test your smoke alarms. We're going to test your carbon monoxide alarms. We're going to go through your house, if you would have us in your house, to determine if like you should change anything when it comes to fire and life safety. So it's basically a free home inspection to ensure that you're up to par when it comes to fire and life safety. So we're doing this all summer, and then it'll end in the fall, and then it'll continue again next spring. And so, yeah, we're hitting every community here in Milton, and I think it's going to go really well. So we're launching that, I think, in June. And so, yeah, that's it. Any questions? That was an hour presentation just crammed into like 10 minutes. So sorry if I spoke pretty quickly and I'm just not sure of the time. I think running out.
That's good. No, thank you so much, Alexandra. Kate Brady says, will there be some kind of notice given if when nobody's home, if they, I'm assuming, yeah.
So that's a great question. Thank you for bringing that up. So we have these door knockers that we just had created with our strategic communications team. And it's giving all this fire and life safety information on this door knocker, as well as our information. So our fire prevention information, so you can call us at any point. And you can request us to come back if you missed us that day and you'd actually like a home inspection. We can certainly come back and do that for you.
I do have a question, and I'm on the telephone, not on Zoom TV.
Okay, no problem.
What is the response time in the urban area?
So when I asked the chief, and I was talking to the crews earlier, they said you're looking at around roughly 20 to 30 minutes.
No, but what about, I'm sorry, the response, I'm not making myself clear. The average response time for those living in the urban area as opposed.
Sorry, the urban, okay, I was thinking, so typically I would say, we always say 3 to 5 minutes. It depends where you're located. But we have a station 3 on Savaline Boulevard. We have the one I'm at right now on Louis St. Laurent. We have Steeles. We have James Snow Parkway. So it just depends on where you're located or if the crews are on a different call. But we always say 3 to 5 minutes.
That's a real disparity between 20 to 30 minutes versus.
I know.
Is there any discussion to improve that for the rural area?
So
on time.
Yeah, so from my understanding, so we have Station 2 in Campbellville, and that's a part-time paid on-call station. So we don't have full-time staff members out of there right now. Our hopes are that eventually we will have that. So we're growing slowly, but we're still a smaller department for the size of Milton. So there's only 4 of us on fire prevention, myself included, and there's about 70 firefighters full-time. Or no, sorry, less than that. So we are hoping, we just got approval to hire full-time at Station 3 on Savaline Boulevard, not for the 24-hour shifts, but for 12-hour shifts. So we're getting there. And I think that eventually, hopefully council will start to approve and realize that there's a need for more full-time staff members. And then with that, the response time will then shorten, right? If there's full-time people in Campbellville area at Station 2.
That's great. Alexander, in the chat, someone wants to know, do fire extinguishers expire? You talked about that a little bit.
Yeah, sorry, I forgot that part. So yes, they do in about 10 years. So every fire extinguisher that you purchase will have a date on it. And just keep a lookout for that, because I know a lot of friends of mine are like, oh, I've had mine for 20 years. I'm like, well, you need a new one. So you just have to bring it to the dump and dispose of it properly. It can't just go in the garbage.
That's great. And someone else has asked if the Acton Fire Department will help.
Yes.
Yes.
Yeah. We have a partnership with them.
And then could you allow rural residents 1 or 2 free fires a year rather than a fire permit? That may not be your department actually.
So yeah, my department is fire prevention. So we do approve permits and I go do the inspections, but I'm not sure of that. I'll have to get back to everyone on that.
Okay, that's great. All right, I think that at that point, thank you so much. I don't see another question other than the thank you for that.
Yeah,
thank you. So I'm going to ask Greg Sage, and of course he is our Chief Director of the Halton Region Paramedic Services, if he would, hello, and you can start anytime.
Great. Thanks, Sharon. Thanks very much for the invite. Appreciate the opportunity to speak to you tonight. I'm going to provide a bit of an overview of our division for you. talk about our staffing out here, with some data to share with you based on what was requested. And if we've got time, I do want to speak a little bit about a couple of new programs that we've launched recently that are doing outreach and more preventive medicine versus emergency 911 response. So if we go to the first slide, please. Or the next one, I suppose. So our team is made up of about 300 staff. The bulk of them are paramedics. We've got 15 stations throughout the region. Our staffing is wherever possible. We staff to try and meet demand. So our call volume goes very, very low between 11 p.m. and 5 a.m. and starts to get very busy around 9 a.m. and peaks at around 1. So we go to reduce staffing overnight. And then as the day starts, we add vehicles at 8 o'clock, 9 o'clock, 10 o'clock, 11 o'clock, 12 o'clock. Last year, we did 56,000 calls for service region-wide, transported 34,000 patients. Next slide, please. So this is our typical ambulance you'll see across the region, staffed with 2 paramedics. And on the right is an emergency response unit. So we've got 4 of these emergency response units around the region. One of them is assigned to the Campbellville station 7 days a week, 8 a.m. to 8 p.m. Next slide, please. You'll also see our superintendents out in the system. There's one superintendent just assigned to to North Halton, so that's Milton and Halton Hills. They're all advanced care paramedics. They respond to high acuity emergency calls, so you may see them around town. On the right is our command post. That vehicle is used for large incidents, disasters, anything with multiple patients, and it also attends special events. Next slide, please. Got a couple of special teams that we've had in place for quite a while now. On the left is our tactical paramedics. So they're assigned to any high-risk incident that Halton Police are attending, primarily with the tactical rescue unit, as Sergeant Dodds alluded to. They also work with the explosive disposal unit, and they may support other teams with high-risk warrants and things of that nature. So these medics train with the police extensively. They're embedded with them. They go into the warm zone, and they're available to provide immediate care to anybody that's injured over the course of one of those events. And on the right is our bike paramedics. So these folks typically handle special events. You may see them at street festivals and things of that nature, but they are fully equipped to respond to calls as well on the bike. There's it's hard to tell with that picture there, but there's quite a bit of equipment strapped to those bicycles. Next slide, please. So we have 2 classes of paramedics. I just wanted to provide a little bit of context about what our team brings. So this is the scope of practice for primary care paramedics. They carry over 20 medications to manage a number of emergency conditions, as well as provide pain relief. As far as procedures, they have access to ICU level defibrillator monitor to do ECGs. They can diagnose heart attacks. They've got advanced airways, bleeding control, CPAP for breathing issues, and taser probe removal is among the things in their toolbox. Next slide, please. And this is the medications that our advanced care paramedics carry. So they've got over 30 medications. We try to have one advanced care paramedic on every ambulance. Some days we have more than others, but they are strategically assigned to high acuity calls. So you could get 2 ambulances responding to somebody who's extremely sick. That's the first ambulance responding in as a primary care crew. The paramedics really bring the emergency department to the patient side. They practice independently. They've got very, very complex medical directives and standards that are approved and authorized by the Ministry of Health. In the event that they do need to consult the physician, they've got access 24/7 to an emergency physician at Sunnybrook Hospital, who will provide additional orders and advice to them if they're dealing with something that's not within their normal routine. Next slide, please. This is the skill set for the advanced care paramedics. So they do some additional things. They've got the ability to decompress the chest. If somebody's got a collapsed lung, they can put a needle in the chest to reinflate the lung. They do some additional advanced airway skills. They do cardioversion and actually external pacing. So you may have family members or friends that have got a pacemaker. We can actually do pacing externally until those patients can get to the hospital and be treated appropriately. Next slide, please. We get a lot of questions about what hospital am I going to go to if paramedics respond. So under the Ambulance Act, all patients have to go to the closest hospital unless we receive alternate direction from their physician. who typically has to be either on scene or actively involved in the care of the patient at the time of the call. Or if there's recent and relevant history at a specific hospital, we can facilitate that. So an example of that would be if somebody had a procedure done at Joseph Brant and they were discharged back home, and within 1 or 2 days they're having complications associated with that procedure, we would, provided they're stable, be able to transport them to Joseph Brant instead of going into Milton District. As I said, we carry monitors to diagnose heart attacks. So the ST elevation MIs is very, very specific type of heart attack. Those patients fare the best if they're treated with cardiac catheterization. So those patients, when they're diagnosed in the field, will be transported directly to Trillium Health Partners Mississauga site. Stroke patients, there's a dedicated protocol for those patients. They will also go to Trillium Health Partners Mississauga site. And for severe trauma, those patients typically go to Hamilton Health Sciences, Hamilton General site. In the rural Campbellville area, it wouldn't be unusual for us to call a helicopter in for severe trauma patients just because of the travel time to get to Hamilton. There's also some specific considerations for pediatric patients. Obstetrics, certainly we try and take those patients to the hospital where they expect to deliver. And then there's also some latitude for oncology patients in the community. Next slide, please. So when you phone 911, the call is typically answered by the police service. They'll say police, fire, ambulance. If you're requesting paramedics, they'll transfer you downstream to the Ministry of Health operated Central Ambulance Communication Center. Depending on where you are in Nassagaweya and particularly with cell phones, and if you connect to towers that are on the north or the western border of Nassagaweya, your call could end up going to the Cambridge Communication Center. We're dispatched out of the Mississauga Communications Center, but those two centers are able to communicate back and forth. And if the call that does end up Cambridge, it'll be sent back to Mississauga for us to respond. There's two different processes in the communications center when you call. So there's a dedicated call taker that does the interrogation while they're asking questions, and there can be a lot of questions that they ask depending on what the situation is. But while they are taking those call details, they are then simultaneously sending a call to a dispatcher who's at another place in the building. That person's dispatching the ambulances and managing the resources. The ambulance system in Ontario is seamless. So regardless of jurisdiction, the closest ambulance always responds to emergency calls. So we, on a daily basis, do calls in Wellington County. We do calls in the city of Hamilton. We do calls in Peel. Peel sends Mississauga crews into Oakville to help out. It wouldn't be unusual for an out-of-town vehicle. It could even be a vehicle from London, Middlesex that's returning to London from Toronto, and for one, they could be assigned to a call in Milton if they're the closest available ambulance. So that's a little bit different than how police and fire are dispatched. We've just the province has gone to a new triage system. So we're really fortunate that our communication center in Mississauga that looks after Halton and Peel is the first one in the province to launch this new training tool. It is a very, very robust evidence-based system that's used worldwide. It's got 5 response priorities, so that the 2 highest response priorities are intended to tease out and identify high acuity patients that are in life-threatening condition that require an emergency response. And then the 3 lower acuity response priorities are better suited for, or are intended to identify patients that can safely wait and don't need a timely intervention. So for low acuity calls, some of those calls could wait a prolonged period of time. Those would be things like minor lacerations where bleeding's not severe, fractured fingers, injured ankles, very, very minor pain, things of that nature. If the system's very busy, could hold. So if you think of how the waiting room works in the hospital emergency department, the patients that are acutely ill get in the door first and get treated. The patients that are stable and don't require an intervention quickly wait in the waiting room. That's what our system is moving towards now, again, with these stable low acuity patients receiving response more appropriate for the condition. Next slide, please. So I plotted our maps in North Halton just to put some context to where we're resourced. So if we start at the bottom center of the screen, that's the Campbellville response station at Guelph Line and Roadside Road. And then going east, we've got the main station on Childs Drive in downtown Milton, our south station of Louis Saint Laurent, and then the east station at 5th Line in Derry. And then we go north, we have a station in Georgetown. Going west, there's a station in Acton. And I also popped the Rockwood station from Wellington County on there because of the proximity particularly with the northern portion of Nassagaweya. It wouldn't be unusual for a Rockwood or Wellington County crew to respond to calls in that area. So quite a bit of real estate for us to cover with the rural area, but very, very low call volume for us. We see about 400 calls per year in Nassagaweya. When we look at it by time of day, we usually average about one call during daytime hours when the emergency response unit staff. So one call per day between 8 a.m. and 8 p.m. When we look at that period of 8 p.m. to 8 a.m., the call volume drops down substantially. We only see one emergency call every 3 or 4 nights. So very, very low call volume despite the geography. Maybe if we go to the next slide, we'll just talk about our community paramedic program. So I just wanted to flag this for anybody that's dealing with family members that are waiting for access to long-term care. The Ministry of Long-Term Care 2 years ago funded a significant number of programs around the province utilizing community paramedics. And these programs are intended to keep individuals who are at home on the long-term care waiting list, keep them stabilized in their home until such time as a bed becomes available, or even keep them in their home longer than they would typically be expected to reside there. So these are not paramedics that respond on an emergency basis. These are scheduled outreach visits that they do. We've brought about 800 patients right now rostered on this program. We've had just incredible success with it. So some of the things that program brings. Next slide, please. So they do home safety visits. They always start with a baseline assessment. They'll do a safety scan of the environment that the resident's living in, big focus on falls prevention, as well as other hazards within the home. And then they look at other social determinants of health, like stable housing. Food security has been a very, very big issue for this team over the last couple of years. We work closely with a number of community groups to address folks that are struggling with food security. They do a whole wide range of diagnostic tests. So again, full cardiograms, blood analysis, 12-lead electrocardiograms. Next slide, please. They'll do a detailed head-to-toe assessment in the initial outset of the patient being rostered. They are able to address any acute complaints. And as I said, their focus is really on preventative outreach and more management of chronic concerns. Another big role that they play is providing cognitive assessments for staff that or residents that may be suffering from dementia or other cognitive issues. Spend a lot of time on medication compliance and coaching, helping to make sure that patients are taking their medication appropriately. It would not be unusual for the community paramedics to reach out to a pharmacist or engage with the patient's primary caregiver, whether it's a general practitioner or whether it's a specialist or a palliative care physician. Perhaps they engage with them on a regular basis, and then really focus on any contraindications or discrepancies with medications. Next slide, please. So again, big focus on chronic conditions, diabetes, COPD, and CHF are the primary patients that we're managing on this program. Wellness checks, it's not unusual for a caregiver or a family member to ask us to do a proactive check on somebody that's rostered on the program. We've just done a significant amount of additional training on wound care, so the community paramedics are now able to provide that service. And then they also provide unscheduled non-emergency requests for service. So see a lot of our roster patients that may require assistance if they've had a fall and they're not injured and they're on the floor. They'd rather have their community paramedics that they're familiar with come and assist them off the floor rather than receiving a response from the 911 side of the operation. And then the other thing we do a lot of is referrals. So we've had very good success with getting the community paramedics in and seeing these patients and then refer them to home and community care or to their practitioners and seeking avenues for them to source additional services. So really serving as a navigator for these folks to point them to what they need. Some of that includes things just like getting income taxes done and linking people up with volunteers to help them with things of that nature. Next slide, please. And we've also got point of care testing. So we do both blood sampling. We can do 13 different blood value analysis. We do urinalysis, wide range of proactive IM medication injections. They can do fluid therapy if somebody's dehydrated and the physician feels that they would benefit from intravenous therapy. We've also got a fairly robust remote patient monitoring program. So this is equipment that we'll put in the home. So it's an Android tablet with a LTE card, and it's connected to a Bluetooth scale, a Bluetooth blood pressure cuff, and a Bluetooth pulse oximeter. And every morning the patient has to upload their weight, their vital signs, and their oxygen to the tablet. And then our community paramedics monitor that in conjunction with other members of the care team. There's thresholds set for patients. So When they log onto the system in the morning, every patient's rostered by last name, and then there's either a red, yellow, or a green light beside their name. They start with the reds. If somebody's showing up as red because their blood pressure is high for some reason, or there's some other issue, they will reach out to that patient immediately and determine whether they need a visit from the community paramedics, whether they need to speak to their family physician or their caregiver, or whether they need to initiate a 911 response. We also do in-home flu vaccine and other immunizations, particularly around COVID, for housebound patients, both those that are rostered on our long-term care program, as well as other patients that do not have access to seek those sources of those medications elsewhere. And we continue to do COVID-19 swabbing in the community, primarily for patients that are waiting admit to long-term care or to palliative care. It's very difficult for these folks to access swabs, so we facilitate that with referrals from community physicians. And we also rely heavily on our community paramedics to swab our staff if they've got any type of symptoms, to make sure that we're keeping our workforce safe. And next slide, please. So the process for this program is, as I said, patients that are on the current wait list for long-term care, or patients that have been assessed as being eligible for long-term care by the LHIN. And then we've also expanded it to look at patients that will soon be eligible for long-term care. So if somebody's waiting to be assessed by the care coordinator, home and community care, they're eligible to be rostered and receive services from the community paramedics. So we don't provide services that other agencies may provide through home and community care, where the paramedics are there to fill a void of services that don't exist elsewhere. The other thing that our program is unique about, we staff 24/7. There's always 2 community paramedics on duty. The other thing we do is as part of the funding proposal from the Ministry of Long-Term Care, they wanted to ensure that clients that are rostered receive visits from a consistent team of paramedics. So there's a lot of frustration with folks that are receiving home and community care services, that they get a different nurse every day, they get a different PSW every day. They have to tell their story over and over again. We've committed to keeping the same core group of paramedics in this program, and they have a certain number of patients that they're assigned to. They see these patients weekly, they talk to them on the phone on a regular basis, and they know them. They have a relationship with them, and they're able to provide a better level of care for those patients. And that is it. My last slide's just contact information and my Twitter. If you're going to follow Sergeant Dodd's Twitter account, you can follow mine too. His is much more exciting than mine.
Well, that
Sorry, Sharon, I think you're muted.
indeed. Thank you. Yeah, someone in the chat said, great work, thank you. And I'll just echo that. That's an awful lot of that was complete news to me. So that's great. Someone asked how and when paramedics are involved with mental health crises in the rural area.
So we respond to these calls on a daily basis. The rural area would be no different than the urban area. Depending on what type of crisis the patient's in, it may not be lights and siren response. It could be a call that perhaps waits 15 or 30 minutes, but it depends on the circumstances. And certainly, if it's a call where police are involved with their specialty team, I'm sorry, Rick, I'm just drawing a blank now, but the mental health response team folks. But we would certainly respond with them on a regular basis and provide support for them. If somebody's in a critical crisis where they're out of control, we do have medications to help manage that and transport them safely to hospital to get them to the care that they need. But we work very, very closely with the police on these calls on a daily basis, and certainly wouldn't be engaging with these folks independently. Police would always be with us.
That's our MCERT team that
Yes,
Greg was
thank you.
referring to.
That's great. Any other questions? So the comment back was, depends on the situation, then seems that police are often the first to respond. So
Yes.
all right, I don't see any other questions at this point. Thank you for your contact info, and we'll make sure that people have that as well. So that's great. Cindy, are you with us? I know you're having some, there you go. So Cindy is a member of the board of the DCCA, which is the Campbellville or Destination Campbellville Community Association, and they are co-sponsors of tonight and of the roadside cleanup. So Cindy, you have some thoughts for us.
I'm going to turn off my video because I've already lost the meeting once and had to restart my computer. So rather than test the resources, I'm going to go on voice only, but I did want to say hi.
Cindy, you muted yourself and we can still see you. So we need to do the opposite.
All right, here we go. Sorry about
Okay.
that.
No
So
problem.
my
Thank
report
you.
is on behalf of Jennifer Sibbett, the chair of the Campbellville Community Association, who's not available this evening. I am, however, a member of the board, so we have collaborated on the following information. Campbellville Community Association has remained somewhat active throughout the shutdown, primarily through the Campbellville Facebook page. And for that, we have a huge thank you for Susan Capone, who's been the administrator of that page. We've been easy to access the information on community events and concerns. This is the point of the whole Facebook page. Our 2023 membership drive is now underway, so please join the community association and be in the know. Since our last community meeting, the community association has held an all candidates meeting in the fall of 2020 for our municipal candidates, which was really the last live event before the shutdown. But we've held movie nights, non-contact in the Brookville Park since, and we continue to host the annual Santa parades, led by Liz Zambrick as the chair of the parade. We did it as drive-throughs in 2020 and in 2021, and we returned to the traditional roadside parade in 2022. Part of the parade is our designated honorary mayor. In 2020, we recognized the community heroes who inspired us during the pandemic. And in 2021, the honorary mayor was John Hand from the Campbellville Pharmacy. In 2022, and our current honorary mayor is John Opstein. The board is looking forward to reconnecting with our community, and we have a really special event that we have planned for September, but I'd love to tease more about it, but there's just too much riding on the unknown, so I have to wait for the official announcement to share that wonderful news. You might be able to read a hint in how I phrased that, but that's up to you. I can't give anything formally. Now there's a tease, and if you thought Wordle was a test, here you go. So our volunteers are always welcome. We're looking for ideas for community events and projects. And if you have an idea or want to volunteer for any of the events, please contact Jennifer Sibbett as chair or myself, which my email is so easy. It's cindy@in.on.ca. I like to say it's short for in Ontario, Canada, anytime. Another annual project now resumed is the annual roadside cleanup and barbecue, co-sponsored with the NCCC. The barbecue is supported with donations from Kelsey's Milton, Tim Hortons, Regional Road 25, Costello's Food Market in Campbellville, Elements Casino at Mohawk, and hosted by the Nassagaweya Tennis Club. And with donations and time from Sharon Barkley and from the town and the region and other participants. For that portion of the project, I would turn it over to the chair of the roadside cleanup. Sharon, introduce our chair.
I will. Betty Robertson and her partner in crime have done an incredible job organizing again this year, and have quite a team that are going to do deliveries. And Betty, you're going to tell us more. I'm going to also put into the chat where people can contact you or if they're interested in signing up. So
and thank you. And Sharon, if you wouldn't mind just adding the contact for myself if they have any questions regarding the Campbellville Community Association.
I will do that.
Thank you.
Thank you. So Betty,
Okay,
you have
hi.
the floor. Hi.
Okay, thank you. So Z, maybe you can show the picture of my dining room right now. So there it is. So I'm going to talk to you about the 26th annual Nassagaweya Roadside Cleanup. And it's going to be happening from Saturday, April 22nd to the following Saturday, April 29th. We're hoping that all of you can set aside a couple of hours to clean up the roads around where you live. You can sign up for supplies. There you go. Sharon's posted it at campbellville.net, or you can give me a call. We're putting together kits with gloves, heavy duty garbage bags, and garbage tags. Sign up by April 18th, and we'll get the kits to your doorstep by the 22nd. You can go out anytime during that week and do some cleanup. Then you just place the bags out with your regular trash with the garbage tags provided. If you're a student or you know a student working on completing their volunteer hours, they can get some hours here. At the end of the week, we're going to have a celebration barbecue at the Nassagaweya Tennis Club from noon till 2 p.m. And that's on Saturday, April 29th. And that's it. So, any questions?
Looking for questions. Don't see any. Again, Betty, thank you for this Herculean effort. All right, and now I'm going to flip back to Cindy, who also is going to give us an update on ACTIONMilton.
Okay, thank you, Sharon. I'm going to stay off camera again because I don't want to lose everybody during the presentation. In the August of 2018, James Dick Construction Limited, also known as JDCL, applied to create a quarry and Campbellville Quarry at Roadside Road and Twist Road. It might have been approved without the community even knowing about it if it hadn't been for a series of events that brought it to light. It started with a resident who was out walking and just happened to spot the sign and notified the community of the application. A flurry of activity resulted. The community responded with grave concerns about the effect of the Campbellville Quarry and the proposed recycling center that was proposed for that site. It would include, but it would include blasting fly rock, water blasting and how it might endanger the water supply, truck traffic, the endangered species in the area, degraded water quality, and so many other real concerns for residents, especially those who live within the real blasting area. ACTIONMilton was formed and to lead the fight, a very expensive fight, with the community raising over $100,000 for the reports and experts and legal fees, and sent a petition with over 1,200 signatures to fight the application. It was a clear message that we were all aligned to stop this quarry. One success, an environmental assessment, also known as an EA, has been approved. However, the EA commences only with the initiation by JDCL whenever they choose. When and if the EA commences, the community may need to raise even more money because the provincial government will not represent our community. We must continue to represent ourselves. We must be vigilant, demonstrating that our opposition to this quarry is unified, and it continues. We are not against all quarries. We need aggregate. One of Canada's largest quarries operates just north of 5 Side Road. But the Campbellville quarry is proposed in the wrong place. It's actually more like a mine. It is not just a gravel pit. And it's using proposed unproven technology in the underwater blasting. The same company broke through the aquifer in Guelph with similar technology and caused a major problem. We can't let our guard down, and for that reason, ACTIONMilton stays active, even in its inactive stage, to oppose any further proposals on activating this quarry application. A wonderful solution would be if the province would designate this property for community use, perhaps even Ford Park. We're approaching the 5-year milestone, if you can believe it, 5 years in August. But we continue to care. If you need a sign or want to be on the email list, simply email info@actionmilton.ca. I'll put it in the little chat room there. But to stay active, and I'm happy to answer any questions. And I see Debbie Stokes on the screen as well. And I know Debbie has certainly been very active in leading this opposition as well. Thank you. Thank you.
That's great, Cindy. Thank you so much. Are there any questions? That was a great summary of where we're at. So that's great. Okay. At this point, then, I'll introduce someone that we all know, Colin Best, who's our both town and regional counselor, rather.
Thank you, Sharon, and thank you everybody for attending tonight, especially all the presenters. Some excellent presentations tonight. Mine's going to be a lot simpler. We've got 2 areas that I wanted to concentrate on. First is the road work. Thanks for Zishan for hosting this, as well as Sharon. These are some of the projects that are coming up. For the biggest one will be the Tremaine Road interchange, which I've already had some comments from people. Unfortunately, due to the 401 widening, it's been delayed in terms of tendering the actual interchange. That is happening this month. They're looking at getting under construction later this year and finishing the fall of 2026. They're also looking at a number of other avenues, as well as doing replacements, road resurfacing on Derry, Guelph line, and just keep scrolling down there. So this is for the whole Ward 1, which goes from Ontario Street west to Millborough line. If you go to the second slide, this is more a map. The green areas are the work that's going to be done in terms of the final coat for Guelph line, the work on the stormwater pond in Campbellville, as well as some work on the south part of that's just south of Conservation Road, Derry Road, and you can see the road resurfacing of the old Tremaine Road, as that's going to be closed off in about 2 years' time, because the bridge that's currently over the 401 at Tremaine will be closed after the new one opens, and because they need the space for the on and off ramps in that area. So there are going to be a few changes there coming, as well as some other works there. The other point I wanted to raise is the province has been very active over the last 6 months, which I think everybody's been aware with Bill 23, that changes the Conservation Aggregate Act, Heritage Act, and regional planning. A province approved a revised regional official plan, not only in Halton, but also in the other 5 regions, as well as looking at appointing facilitators to review all 6 regions. That's Waterloo, Halton, Peel, Niagara, York, and Durham, and looking at changing the services, because as the province pointed out, regions have been in place for almost 50 years, and this is their first major review, as well as they're changing the Places to Grow Act to a new act to embody the changes the province has put in place over the last 6 months. So a lot of things underway. Last Thursday, the province also announced some changes for new home buyers and renters, as well as looking at expanding rural hamlets, villages, and other rural communities. So that's open for discussion right now. Both the town and the region will be making public comments, and we're looking for your input, as well as the region is doing their strategic plan for the next 4 years. So welcome your comments to it. As it was at halton.ca, as well as the town is going to be doing a lot of their plans. So that's my presentation so far. So if there are any questions, you could ask me now, or you could email me at colin.best@milton.ca.
That's great, Colin. Thank you. I know that you're very busy with representing us at AMO as well. So that's great. So now, last but not least, our Ward 1 Town Councillor, Christina Tesser Derkson. So you have the floor.
Thank you. Thanks so much, Sharon. And thanks to everyone for attending. I look forward to when we can be in person again. Those are fun events and we're able to get together and have good discussions and have our questions and answers. There's a lot of ground that's already been covered. I want to focus on two specific things that residents can have immediate impact on right now. And as Colin mentioned, there's official plan review going on right now. So at the town of Milton, we're reviewing our official plan. Right now, the staff and all of us are seeking input from residents on the current part of the review, which is moving in Milton. So this is looking at transportation related topics. So this is going to inform and review the update of the official plan. Now, I know often, and I hear from you, that there seems to be a lot of focus and planning on urban traffic and urban transportation. So this really is our opportunity to make sure that the rural perspective is taken into consideration. There's some similarities, but I think very different types of issues with respect to transportation and transit. We've already talked about the traffic. Officer Dodds or Sergeant Dodds was discussing that, and the different concerns with speed. We have a school on Guelph Line. So I think it's really important that everybody have their voice heard there. You're important stakeholders. And I think actually that staff should be reaching out to the NCCC. Betty, I think there was some discussion about that. Correct me if I'm wrong, about having some formal stakeholder discussion. But anyone is free to contact staff. And what I can do is I can send out the email, or you can go to the town's website. It's fairly easy to navigate on the traffic page, and there's a submit your input button. And you can submit input on the official plan review at any time, but right now they are focusing on the traffic strategy. So some of the policy considerations here, we're looking at accessibility, equity, and inclusion in our transportation plans, connectivity, continuity, and convenience. There's growth and traffic management that has to be considered, moving goods and services, as well as us in our cars. Sustainability is a focus, and climate mitigation. And the rural area is one of the policy considerations. So we want to make sure we have lots of voices weighing in on all of them, and particularly in the rural area. And I'd like to see lots of focus on the sustainability piece as well. On the traffic piece, I'm also going to mention that there was an update recently to our traffic calming policy. What's happened is that we've actually made it a little bit easier for certain areas to be to have traffic calming implemented. So we've lowered the threshold, basically. Traffic calming is things like physical implementations, curb cuts, little islands, speed bumps for the first time we're discussing. Now, the problem with some of these implementations is that they're not available on regional roads or arterial roads. So when we talk about Guelph Line, for example, you're not going to see speed bumps on Guelph Line. However, in our last budget, we talked about speed enforcement cameras. So there's some areas where Colin and I are pushing to have that type of enforcement in place. And I think Guelph Line around the school would be a good location. So we're looking for input on that as well. The other area I want to mention where residents can have some immediate impact in the input they provide is with respect to what Colin touched on, Bill 23, and the changes that the province is implementing in order to make it easier for housing to be developed. Now, this is specifically in regards to what we call additional residential units, or ARUs. You may have heard in the city of Toronto that they're contemplating adding garden suites. So right now, what Bill 23 has said is that in the urban area, an existing dwelling, whether it's a detached house, a semi-detached townhouse, can have up to 2 additional residential units. So you're talking about possibly 3 residential units on an urban property. A residential unit meaning it has a kitchen and bedrooms for people to sleep in. So we're talking about garden suites, nanny flats, coach houses, laneway houses, in-law suites, stuff like that. Now, the provincial changes do not require a review of rural properties. However, due to some pushing by certain councillors, present company included, there is going to be a focus by our staff on implementation in the rural area. So depending on what side of the fence you're on here, you're going to want to have some input. We've had people contact us saying, I would love for my parents to be able to live on my property. I've got lots of space. Why can't I build an in-law suite? And we've had other folks who are concerned that they don't want to see additional residential units on properties because of the impact on water and that sort of thing. So there really is a pro and a con here. There's people who want it, there's people who don't, and we need to make sure we get it right. So now's your time to provide input on that as well.
And that can also be submitted through the Let's Talk Milton platform, which is part of the official plan input. At any time, and I have people contacting me saying, it's so hard to find the right web page or the right link or the right staff. Just email Colin or I anytime, and we will link you up with who you need to talk to. It's much easier for us to navigate that than for you. So feel free to contact us anytime to do that. Okay. And our information is available. Just Google search Colin Best, Christina Tesser, you'll find us. So that's really the highlights I wanted to bring to your attention. Happy to take any questions on any of that.
That's great, Christine. Thank you. We have a question that says, can we get speed bumps on Campbell Avenue East, as we're now getting lots and lots of traffic when the highway backs up?
I would say probably not. And that's because in the current policy, Campbellville or Campbell Avenue, I believe, is considered an arterial road. So similarly to Martin Street, for example, you think Martin Street, there's like 3 schools right there, tons of residential, lots of pedestrian traffic. They do not qualify for speed bumps on that street because they're considered arterial. So I don't think the current policy would allow that. That's not to say there aren't other measures that we can look at. If there are particularly troublesome spots, we already have some things we implement, like driver feedback boards, which work temporarily, really. The traffic enforcement cameras, those are very expensive, and the pilot is going to be very limited with where they allow the cameras to go. Those areas are going to have to meet very specific criteria. So a short answer, no, I don't think you're going to see speed bumps on Campbell Avenue anytime soon. But that doesn't mean we can't continue to make efforts and work with police services to make sure that the yahoos on wheels are being apprehended, and people know that they can't speed and drive recklessly through those areas.
That's great. Thank you. Someone has asked a question that I don't know if you'll know. I'm just saying you may want to get back to them directly. It says, what is going on the east side of Guelph line across from the racetrack? Do they have permits? And if not, how do they continue? So.
Colin and I have both, well, Colin more so maybe I'll let him take the question, but yeah, there's a problematic area. Staff are well aware. There are inspectors attending regularly. There is investigation going on. We are fully aware of the problem. People have reached out to us. Colin, I don't know if you want to contribute to that.
Yeah, just saying, unfortunately, this is not the only area. We've also had other inquiries in other locations in Guelph line. And it's happening in other rural communities where people are making money dumping fill and charging truckers from doing this. And it's something that we've been on to, and I thank the people that have commented to us, because it is a concern when property owners flagrantly disobey the law. They've been told already that's within the NEC area. NEC inspectors have been out there, town staff's been working on it. It's a very frustrating, because I've talked to other municipalities, and they're just, they have dozens of sites like this. And it's just, with all the construction from the GTA, they're looking for places to dump. And it's very concerning when there is environmental contamination possible as well.
All right. We have a question asking for Sergeant Rick's contact info. And to be honest, I don't have it at hand. I'm going to put the Rural Watch email in our chat right now, and see if, unless if you want to contact either of the councillors, I'm confident that they would be able to pass that on. Yeah, that's great. Okay, I think that we have come to the end of the questions, and I want to thank everyone for participating. I hope this is a format that worked for people, and I think that having it recorded, and we're going to, as I said, put it up on YouTube, that will be good for people that weren't able to make it. And I want to thank all the presenters, because that was great, and it moved right along. And I had said 8:30, and it's 8:32, and that's always amazing. So, all right, I guess on that note, unless there's something else, and Zishan again, thank you. So, okay, we will see you in a year, and hopefully we'll see you at the roadside cleanup barbecue and the cleanup. Okay, take care. Thanks. Bye-bye.